Thank you, everybody.
So yes, I taught 7 years in the medical school. I set up a department of integrative medicine. We put in a master's program in nutrition, and I put in 5 courses in functional nutrition. And now I'm in the pharmacy school, and in the pharmacy school, I'm putting in nutrition courses, trying to get it. So in Florida, if you're a pharmacist, you can, and of course a physician, you can practice nutrition with and charge for it. Other states, they have it only a licensed dietitian, or now they're calling themselves nutritionists, are allowed to charge. So what I'm working at Nova is trying so that when our graduates graduate in pharmacy school, they would also be eligible to get, not only be a licensed pharmacist, but a licensed nutritionist, even though they can still charge. If they go to other states or Medicare, they can't charge, they have to charge under a physician. Now, what we've done at Nova, and I'm glad there's so many physicians here and pharmacists, because I also have an MBA in healthcare. And sometimes when I talk at the medical school about making more money, it gets people upset. But what I'm talking about is you making more money and also enhancing patient care along the way. And that's very, I think, appealing. And so I'll talk a little bit about that. What we're doing right now, we have a physician group that are internal medicine board certified MDs that we're working with, who have 4 clinics, one in Boca, Boynton, Green Acres, and one up in Lake Okeechobee in Belglade. And so that is a very interesting social dynamic, because Belglade has almost all, say, Medicaid patients, whereas Boca would have a very high end of patients willing to pay $5,000 or $10,000 for VIP services a year. So you've got a big gamut, and then if middle-class people in between that are on Medicare and have regular insurance. So we're setting up various programs in all of her clinics there. So one of the biggest things probably maybe that you've run across too, and what they're doing right now, is the Ozempics and the Wegovyas and all of those types of things. And we actually have other pharmacists from our pharmacy department working with her as well. And what they're doing is they are making sure that those things go through insurance. How many of you have prescribed those and are having a hard time getting those through insurance? Right? Quite a few. So this is the wonderful thing, right? About we're going to make more money and give more patient care, because one of the things that the insurance company will come back and say is, did they have a lifestyle, review? Did they have a nutritional consult? And those are things that you can make money on. So that's the type of thing that you're helping the patient, giving better patient care, and then you're enhancing possibly also your bottom line as well. And, I say to doctors and pharmacists, the first person, when I teach residents at the Broward County Hospital, and I always ask them, what's the first thing you should do to help your patient? And of course, most of them say, listen, right? Or really read the labs well. And I said, no, it's not that. You need to take care of yourself. Because the bottom line is, if you had a bagel at 7 a.m., which makes your blood sugar spike, like it's one of the worst things you can possibly do unless you put some fat with it and protein. But if you had a bagel at 7 and now it's 10, your blood sugar's in the toilet, you can't even hear people. And I've got hypoglycemia. I might bite their head off because I get the hangry if I eat a bagel, forget it. So that's the types of things when our residents are learning to take care of themselves. I talked to Jeff, and he teaches in a residency program. And there was a study that came out that actually showed that when you taught residents nutrition, they themselves became healthier. So I have a nutrition program, and I don't really even see the students in pharmacy, because we started it during COVID, so it's asynchronous, which means they take it and they do the lessons, they put the lessons in, and I write notes back and forth to them. So many of them will say, Dr. Lafferty, after your class, I don't eat fast food anymore, or I'm eating breakfast now with some good protein in it, or whatever. So I have a lot of students coming up and telling me constantly that since they took the course, they're doing better. So those of you that might teach at universities, this is really, really important. And Johnson & Wales Cooking School actually partnered with Tulane Medical School many years ago. And what they found was when they taught the medical students to cook, that they too actually talked more about nutrition, things that they could make at home and things like this. Now, I've heard, and I think this is where some of this lifestyle medicine things are coming from. I've heard a lecture, he got like 60 million hits on TED Medicine. He's a physician, and he's saying, diabetes causes obesity. And he said, no, it's the other way. Obesity causes diabetes, or maybe I don't remember. But you know what I have to tell my students? I'm almost 65 years old. I graduated in 1982, and guess how many type 2 diabetics I had? How about you that are older? In 1982, how many type 2 diabetics did you have? I had 2, and they were 70. And neither one of them actually was overweight. So this is what we have to think about. I have to tell the students, no one had rheumatoid arthritis. half of the reason I got they brought me to Nova, and I got the endowment was there was a patient that I had that she got diagnosed with rheumatoid arthritis at age 2, bleeding ulcers from prednisone at age 10, a grapefruit-sized tumor in her knee at 15 from Humira and methotrexate. Now she could hardly walk. Her wrist and her shoulder had fused, and she came to me. And how many of you know what the cause of rheumatoid arthritis is? Anyone? Yeah, you wouldn't probably know the cause because if you go to Harvard website or you go to Johns Hopkins website, they'll say, we have no idea what causes it, use these drugs. But if you put gut bacteria and rheumatoid arthritis in PubMed, you'll find over 300 articles. The etiology of rheumatoid arthritis caused by dysbiosis, which means that the gut bacteria, the negative gut bacteria, have overtaken it. Or if you send the stool to the lab that I use that uses PCR technology, you'll see that these people have an abundance of Klebsiella, Prevotella, which are the ones that are implicated. And you'll find that they're good bacteria, always Bifidobacter, sometimes Lactobacillus as well. It's very low. If you had the experience I've had, my boss who came in, now she's the director, and she was my boss after we hired her to be the head of integrative medicine, a doctor from Canada who's older, she's probably about 70, very brilliant woman that has taught me so many things. And she started out as a pathologist, and she said, Lynn, we used to do really cool things back in the 70s in the hospital. We actually did punch biopsies of the rheumatoid arthritic nodules. And she said, there's all sorts of bacteria running around there. And she said, and actually there was a study, I think it's from like 1982, that talks about finding C. diff actually in one of the rheumatoid arthritic nodules. It's just now with the PCR technology, which means, anaerobics die, so you can't culture them the way we learned in school. What you can do, though, you can see that the DNA of that bacteria is in the stool. So those are some of the things that we do in our practice. Let me just see if I can get this. Yeah. Do I point it to here? Or do I point it the other way? All right. Okay. All right. I'm not sponsored by anyone for any company or anything like that. So what is nutrition? It's the science that interprets the interaction of nutrients and other substances in food in relationship to the maintenance, growth, reproduction, health, and disease of an organism. It includes food intake, absorption, assimilation, biosynthesis, catabolism, and excretion, the amount of calories needed for physical activity to sustain life, and the quantity of macro and micronutrients that are needed for optimal health and wellness. So that's what we're looking for when we talk about nutrition. Now, why didn't we have all these diabetics and obese people? I mean, yeah, my grandmother had a 75-acre farm, and she still was chubby when she got older, because when you go through menopause, women gain weight. That's our estrogen factory, if you will. But why is it that none of these people, even though they might be considered obese today, why didn't they have diabetes back then? Because they were eating clean, organic food. I mean, they didn't put all these pesticides and everything back in the 50s and 40s on their food. They grew their own food. Didn't have a lot of food probably like we do today. I know there was a family of 7, so I know my father said a lot of times they didn't eat a lot of food. They didn't in the winter time, because it was up outside of Buffalo, New York, in the country where my family grew up. But they are very healthy people. So that's the optimal health. So in Florida, at least, like I said, you can practice nutrition if you're a pharmacist, a dentist, a chiropractor. And again, I think a physician, I would check this out, but I think you could have anyone really practicing with you nutrition and bill it under your license. So I wouldn't have just anyone, but I think that you're able to do that under a license. And you don't have to take, in Florida, you don't have to take the exam if you're a professional. It's a waiver. So this plays a critical role in health promotion. And I'm not sure why I put that one in. So 56% of Americans surveyed said they were trying to lose weight, yet 9 out of 10 did not know how many calories they should even be consuming each day. And we find some of the guidelines that they have. Survey reveals diet disconnects that interfere with healthier eating and weight loss. 70% of those trying to eat healthier said they were doing so because they wanted to lose weight, yet only 11% of Americans know how many calories. Now, I don't really think calories are important, but I think what is more important than calories is how is the food prepared. So I'll have students coming. We get a lot of students from India and from Africa that come to our school that are already pharmacists, because they have a program for that, because we had a big shortage of pharmacists. So if they're pharmacists in their country, they have to go 3 years, and then they have a pathway to become a pharmacist here. And all of them will say, you know, I'm eating exactly the same way, the same amount of rice or beans or whatever I did in my country, but I've gained 15 pounds. Why is that? I don't understand why that is. So we don't have the same quality of food as a lot of other countries, because countries don't have the money that we have to put all the chemicals and use the GMO foods and all these different things. It was really wonderful. I took the train down to, when I was in Egypt, I took the train south, and I'm so happy I did, because I got to watch the farmers. They get up at the crack of dawn and they do their prayers, but they're still using donkey carts and everything like they did 1,000 years ago. And the quality of food in Egypt was very good. You could taste the difference between the chicken and a lot of their vegetables and things like that were grown like that. 84% say they are physically active for health benefits at least once a week, but 44% who are active say they don't balance a diet and physical activity to manage their weight. It's funny, I was on a speaking circuit with the first general who was in combat, and at age 45, she had to quit the Army because she was on 16 drugs for fibromyalgia. And she came out and she said the only vegetable she ever ate was a pickle. And she said, I was fit, but I wasn't healthy. And she's on YouTube. She actually shows a picture of herself. She's like 55 when she's talking, and her face and everything. She looks a lot younger at 55 than she did when she was 45, just from changing her diet, incorporating more fruits and vegetables. So it's not all about calories, because the biochemistry has to be fed in order for that to happen. And another thing is, what's our number one liver disease that goes unnoticed, right? It's a silent disease, fatty liver disease. That's where fat gets broken down. So if your liver can't even break down its own fat, how is it going to break down the rest of the fat from the body? 90% say breakfast is the most important meal of the day, but less than half reported eating it every day. Carbohydrates, confusion of low carb diets versus grains and fiber from whole foods versus the detrimental carbs. Americans believe that consuming specific foods and beverages can provide health benefits like improving heart, 80%, digestive, 76%, stamina, 76%. Yet more than 50% of those surveyed say they don't actually consume those foods, even though they know that they're good for them. So I teach at another school too. It's a very, very small school called John Patrick University, and teaching psychology of nutritional psychology. So that's plays a big part. And it plays a big part in our outcomes too, of how well our patients do. I remember when I got my MBA back in 1987, we had to do a first world country and a third world. And we looked at Jamaica as our third world. And at that time in the book, it showed that the witch doctors, if you will, actually had a 70% cure rate of all diseases. And now actually I also teach a mind body course and have looked at the research, and it's actually higher than that now. A matter of fact, we used to make, I don't know how many of you remember, there was actually, I think it was Lilly Pharmaceuticals made a placebo that doctors actually used to prescribe. Does anybody remember that? Yeah. That you could prescribe a placebo, because the drug companies actually are having trouble with that because the placebos are working more and more. So they can't show that significant difference. So how can we support our patients? Well, one of the things is the stages of change. So there's contemplation, determination, action, maintenance, and reoccurrence. And this is the same thing that they look at with drug abuse. Like where is our patient on the stage of change, and how do we need to address it? Now, something very interesting, I also, 25 or 30 years ago, I lived in San Francisco and I worked with the most famous addiction medicine specialists out there. And we got a grant from Joan Kroc, who was Ray Kroc's wife, who started McDonald's. And she said that, that at that time, she went to 5 doctors. Her husband was an alcoholic and had liver cirrhosis at that time, and not one doctor told him to quit drinking. So what she paid for was to bring more addiction medicine and things into the world of medicine. Motivational interviewing is very important because the head, probably the most famous person in my space, is a woman named Tracy Gadet. She started with Andrew Weil for physicians, the functional medicine, or I think they call it integrative medicine master's at the University of Arizona. Then she went on to start an integrative medicine department at Duke. And her biggest thing was coaching, looking at how do you coach someone and motivate them and keep them motivated and keep them engaged. And then she got $1 billion to put this model into the VA, where there would be battle buddies. There's battle buddies when they are in the military together, and that she was putting them together to keep each other motivated. And one of the things that she talks about in this, so she says, okay, you have a 55-year-old that's been smoking and now he's got emphysema, and you're talking to him about his health getting worse. It's going to get worse. Is that an effective message? How many times do you think he's heard the diseases that smoking will cause? A lot, right? And it hasn't worked. So she said, what she talked about was, how do you connect with the patient with something that might matter with his health? So what she found with a patient, that he just had a new little grandson. And yes, the emphysema does hurt because he can't chase him around like he would have. And yes, he would like to see himself at his graduation and see him graduating from high school and maybe even college. Would the behavior you have now, do you think that that could happen? No, I don't. Do you really want it to happen? Yes, I do. So how do we engage a patient with something that's important to them? It was funny. I had a smoking cessation program out in California a long time ago. And inevitably, when I would tell the people in the audience or whatever, because there was a lot of smokers back at that time that were teachers still, but I would tell them, you know, your dogs get emphysema. They would come back the next day, they go, you know what, I'm quitting smoking. My dog's lungs are getting hurt. You know, they could care less about themselves, but they didn't want their dog getting hurt. So you never know what's going to motivate someone. So it's important. It's an important thing to ask people, you know, how can I help you better? And inevitably, those of us who feel good when we see a patient getting better, then this kind of thing, the more tools in our kit actually makes us feel better, right? And gives us a sense of more purpose and things like that. Sorry, I keep doing that. So the nutritional, there's different things that the government has looked at. So this comes basically from Medicare. So these are things you can bill for. You've got the nutritional consultation. That's a half an hour and you can bill for that. And you can bill anyone for that. Some insurances I've seen, like there was an insurance called AvMed, they gave each patient $1,200 for nutritional consultation and labs and stuff. So it goes anything from that to them paying you $12. So, you know, you just have to find out what each insurance wants. But it runs, I would say, about $50 for a half an hour for the nutritional consult, maybe on average. Some of the insurances will reimburse you up to $65 or $70 for that. Diabetes self-management training. Now, this is something very interesting, and I think you have to connect with a local organization, but I don't think it takes anything for you to do this. But what we're doing or setting up right now are Zoom meetings. So you can charge the patient. I think you get like $30 or maybe it's $22. There was just different rates for this. But because believe it or not, if you're in Miami, you get a different rate than if you're in Wyoming. I didn't know Medicare had different rates. I thought they had one standard rate, but they don't. So don't quote me because I'm looking at in South Florida. So it might be a little bit higher or lower where you are. But anyway, this is something you could easily do is yourself, or, you know, I think it's great for pharmacists and doctors to partner. You can do this self-management group, and they pay, like I said, about $20 per person. And if you have 20 people in the group, and it's a half an hour, so that's like a $400 thing that you could be making. But again, I talk about the money. Please don't get offended by it, but I hope it's a motivational tool for you, because guess what? They wouldn't be paying this unless one thing, it works. So you're giving the optimal care to your patients when you do these kind of things. And if you make more money to help people, or take a nice vacation for yourself so you're not so stressed out, so you can listen better to your patient, it's all really good. That's, I think, the way life should be. And then you have something called medical nutrition therapy, and that's something that you can bill for with people with chronic kidney disease or with diabetes. And I believe you might be able to with with obesity, like obesity with a chronic condition like congestive heart failure or something like that. Again, that pays quite a bit of money too. That's like the $65. So it's, like I said, it's paid by Medicare. You pay nothing. They say, this is what they say, this comes from their website. You pay nothing for these preventative service if you qualify to get them. Your doctor may recommend you get services more often than Medicare covers. You may have to pay some or all of the cost. So first they say, typical government, right? First they say you pay for nothing, and then at the end, oh, you might have to pay for all the costs. So that's why if you think I'm confused, it's confusing. So those are quotes from them that I got from their website. So medical nutrition therapy is an intensive, focused, and comprehensive nutrition therapy service. Involves in-depth, individualized nutrition assessment, relies heavily on follow-up to provide repeated reinforcement. So I really like this because they didn't used to pay for this, that they understand, again, it's science-based, it's evidence-based, that the more you're talking to somebody about staying on their diet, guess what? The better they're going to do. And with these expensive drugs and the expense to hospitals and to Medicare, they finally figured out paying doctors' offices in a primary care setting is going to be more cost effective than what is going to happen down the road. Establishes goals, a care plan and intervention, plans for follow-up over multiple visits to assist with behavioral and lifestyle changes. And also they do pay for the psychological services that are related to this, relative to each individual's nutrition problems and medical condition or disease. So diabetes, you have to be licensed or a nutritionist or a healthcare professional, provide overall guidance related to all aspects of diabetes, increase the person with diabetes knowledge and skill, promote self-care efforts for effective self-management and glycemic control. Again, to me, you have to change the quality of the food. It's imperative that we do that. So I try to teach people. I have a website called drlynlafferty.com. There's a lot of videos on there, like things you can make from home and how to grow herbs and things like that. So even if you can just grow your own potatoes, they're like the easiest thing in the world to grow, or there's a lot of things that we can grow, or even indoor. They have these incredible indoor gardens now that are, has anybody seen those? Maybe I can find a picture of them during a break. They're just incredible. They have all this lettuces and tomatoes and everything, and they're all indoors, and they're grown in these little pods, and they're really pretty. Like they look like a piece of art too it's cool. So you get an initial nutrition and lifestyle assessment. So that's what we're doing right now at the doctor's office. We're going through her medical electronic record, and we're trying to find all the patients that have diabetes, obesity, and chronic kidney disease. So we can give them their initial consultation and a lifestyle assessment. And anybody else that she's trying to get the Wagovias and all of those through. You can do individual and or group nutritional therapy services. So we'll be doing both. You can do both. Help manage the lifestyle factors that affect your diabetes, follow-up visits to check on your progress in managing your diet. So prevention, diabetes self-care management. Part B covers certain doctor services, outpatient care, medical supplies, and preventative services. Self-management training, if you've been diagnosed with diabetes, Medicare may cover up to 10 hours of this initial training, 1 hour of individual consultation, and then 9 hours of group training. You may also qualify for 2 hours of follow-up training, so personalized follow-up training. To get this training, you must have a written order from your doctor. So it's important. Nobody can do this without the physician approving it. And again, this might be something, maybe you're not interested in putting this in your practice whatsoever, but I would recommend you finding somebody in your area that's doing this kind of thing, because it's really going to make your job, like I said, including getting these drugs approved, a lot easier. So diabetes self-management training teaches you to cope with and manage diabetes. So it has tips for eating and being active, monitoring blood glucose, taking prescription drugs, reducing your risk. Some patients may be eligible for also the medical nutrition training. So you can put both of these together and they can go through all sorts of training for a whole year almost. So it's a lot of stuff that's covered. Again, they've had your hemoglobin to have this has to be between 5.7 and 6.4. Fasting has to be between 110 and 125. So what they're trying to do here is they're trying to, for the prevention services, they're trying to catch the people that are headed into diabetes before they actually get there, and a BMI of 25 or more. Unless you're Asian, it can be 23. And this program has 6 months of weekly sessions, training to have more realistic, lasting behavior changes around diet and exercise, tips on how to get more exercise, strategies to control weight, a specialty training coach to help you keep you motivated, support from people with similar goals and challenges. Once you've completed the weekly sessions, you'll get a 6-month follow-up to help you maintain healthy habits. So you have to become one of those programs, but a physician can become that. So especially if you're out in a rural area, you might even find a grant to help you do all this too. They're really wanting people from rural areas because they're hard to get these services. Now, there's no reason that somebody couldn't partner with what we're doing. There's no reason we couldn't add your patients to what we're doing. So there's probably a way that you can work with a lot of different people. And then we have medication therapy management, which pharmacists mostly are doing. And this is a written summary of your medication review with your doctor or pharmacist. It's a recommended to-do list, medication list to help you make the best use of your medications. It may take many medications, more than one chronic condition. Contact your drug plan. So usually it's for people that are on 3 or more drugs that the insurance covers the medication therapy management. Have any of you gotten calls from these groups asking you to switch medications because the medication is too expensive? Because they'll do that too. Yeah. Very interesting. There's a drug that's $250,000 for rheumatoid arthritis, but yet we have desiccated pituitary glandular and it has that same thing in it. And it's about 15 cents a tablet. So anyway. Again, you have to be in Part D, but there are actually regular insurance programs like our insurance. We have Blue Cross Blue Shield. They cover this. We actually have a call center because we have a group. This company has 20 different universities in their group. And so there's about, I think, 25 or 30,000 patients or more. And we look at their drugs and things like that. So again, there's billing codes for that. And that usually initial visit, if you do this, and you could use your PA to do this or as well if they're trained, they understand the drugs. And I think you get about $120 for doing this. And it actually helps the patients quite a bit. Because sometimes, you know, if as a physician, you're so busy, you don't really have time to monitor things or really question the patient. We found, I wrote a paper, a publication on this where a lot of times, for whatever reason, I think it's a horrible idea, but when you go to a hospital now, they usually put people on proton pump inhibitor. And then at the end of when they get out, they shouldn't be on it. But unless there's supposed to be a pharmacist or someone, a specialist, that now monitors that when they leave the hospital to call the doctor and say, you want this chronically, the patient on this? And 99%, no, I don't want them on that. So that's a real problem because, you know, chronic use of a proton pump inhibitor leads to decrease in absorption of calcium, B12. So it's shown in research, more broken bones, more dementia, more C. diff infections from chronic use of proton pump inhibitors. So again, what's in the consult, you want to do a lab review. Blood sugar is especially important. Want to find out what are they eating now. I think that's very important. Is it homemade with real ingredients? So, you know, when I was a kid, we had candy, but our candy actually at the store, it was made with real coconut oil, not trans fat. And it was made with real cane sugar, which cane sugar, I actually prescribed turbinado sugar for a lot of the patients because turbinado sugar has brown around it. It's not brown sugar. Brown sugar is they take the brown off, and that's called blackstrap molasses, which is probably the most nutrient dense product in nature. And then you're left with white sugar. You need minerals for that sugar to get into the cell, especially chromium. So what happens then if you don't have that and you're eating a lot of sugar and sugary products like donuts, let's say, or whatever, is your sugar goes, okay, where are my minerals? Oh, your teeth has minerals and your bone has minerals. Let me just demineralize myself. And then when I demineralize myself, guess what? I get cavities and I get periodontal disease. So it's fascinating. I mean, these studies are back from like my assistant dean that I reported to before my other boss, who was really smart. The other ones weren't so smart. But anyway, would say, why are you showing me studies from like 1935 or 40? But there was a study and they did back in the 40s. They're very fascinating studies. It doesn't make them not relevant, where people who have sugarcane, the people that are cutting down the sugarcane chew all day on sugarcane and they have no cavities because they're getting all those minerals and they're very healthy. So if they cook themselves using real cane sugar, has a very low glycemic index. That's to me what the most important is, if your blood sugar spikes or not after you've eaten it. So white sugar has a glycemic index of 100, like a bagel. Your blood sugar really spikes, but turbinado sugar has a glycemic index of 40, and then agave syrup has a blood sugar of about 15. I mean, a glycemic index of about 15. So those are natural sweeteners. They do have calories, not that many calories. I think, what, 15 calories per teaspoon or something for sugar, for turbinado sugar. Is it GMO or not? I mean, I think that's so important. If something's GMO, you try as hard as you can to stay away from it. We don't even know what this food is going to do. I mean, there's even a question, they put fish genes in GMO tomatoes. Are you really a vegetarian or a vegan if you're eating a tomato that's GMO, And then, are they fresh or are they canned? And are they canned at home? I just went to my cousins. I said, I want to make pickled beets like grandma did, because I like, and beets are like a miracle, you'll see, for just about anything. It's so great for your gallbladder and so great for your liver. They're really clean out. That's my snack. If I get really hungry, I eat pickled beets. So we do anthropometric evaluation. This is looking at, the amount of fat, your waist circumference, your BMI, your height and weight. And then the different labs. You want to do a lab panel, the basic labs you're doing. You also want to do inflammatory markers, because a lot of fat is, a lot of weight gain actually is caused by inflammation. A matter of fact, one of the things that people have lost a lot of weight on is a food sensitivity test that I do, which looks at, some look at your IgG, and those are more directed towards if you have a real food allergy, like, a peanut or shellfish allergy, where you have just this enormous amount of powered immune system response. But this test actually looks to see if any of the immune factors are coming out of your cells, and we call it sensitivity. But that can lead, if you're constantly eating peanut butter and that's something you're sensitive to, you're going to have a low grade chronic inflammation thing going on in the body, and that can lead to quite a bit of weight gain. So a lot of the things that we see are the weight gain we're seeing actually is from inflammation. So what are some inflammation and pain labs that we can do? So here it talks about the role of nutrients in reducing risk for non-communicable diseases during aging. And it talks about just over here, decrease in toxic inflammatory foods, increase nutrient dense foods like antioxidants, plants, and pasture raised meats and fish that come from the sea, not raised in a tank. And women, vitamin and mineral deficiencies lead to fatigue, cardiovascular disease, cognitive impairment, immune impairment, muscular skeletal vision, and many other issues. So our innate immunity, we know, is against pathogens, and it releases the mast cells, which the mast cells release the histamine, which is chronic inflammatory. And also we have our white blood cells, and we have the cytokines. So the cytokines, again, we learned a lot about those, of course, during COVID, where we want the people that died, really, they died from a chronic cytokine inflammatory condition, right? That's how come they died. So we can look at all these different cytokines as well. And we have our natural killer cells with our immune. So we want to consider our white blood cell count. It's elevated during infections, or if we have too much cortisol. Now, that's really an important thing, because stress is a big relationship to weight gain and diabetes. Cortisol raises blood sugar. And cortisol, the chemical name is cortisone. So that's where prednisone comes from. So all the side effects that you know about prednisone, where it can cause diabetes, can cause weight gain, all of these types of things, even psychosis, cortisone can cause. All of those types of things will be the same things when you're under chronic stress. with elevated cortisol. You're having those same reactions chronically going on in the body. We also want to look at, again, our ESR, because that can also be from chronic inflammation if it's raised. Patients can increase or decrease depending on different types of infections of that. So again, our neutrophils, we've got our lymphocytes and our monocytes, and that's important. So we find that the eosinophils increase with allergic conditions. Allergic conditions as well, very tied to your adrenal gland and stress and asthma and those types of things. And if you look at the literature, you'll find, for instance, children who live in the inner city that are chronically under stress because guns are going off have a lot more asthma than somebody that lives out in the country. So, you know, has a better life, maybe a better lifestyle and life conditions. So again, we have our inflammation process where we have either a physical condition, or we have something like our shoe is pinching us and we get this chronic inflammation. And it's a very vicious cycle, arthritis, so food and diet can play a huge role in inflammation and in arthritis and all these types of conditions. Now, one of the things that I use a lot with arthritis is something called phosphate. Phosphate, it's just liquid phosphorus, and phosphorus actually makes calcium go into solution. So when I talked to my boss, my former boss, about the rheumatoid arthritis, not only did she say that there were bacteria running around, she goes, there's all sorts of calcium crystals running around there too, and those cause pain. So it's kind of fascinating in my office. Let's say if somebody has arthritis in their hand, I'll have them just bend it to where you can, like they'll go like this until it hurts. And then I'll have them take a dose of phosphate, and I'll wait a minute or two and I'll say, well, do it again. And they're like, oh my gosh, how did that happen? You know, and I don't have any pain anymore. So it must, when she told me that, I said, I sort of knew that because I've been doing this with the phosphorus. And I figured there must be tiny crystals that melt immediately. Of course, you're not going to melt a whole hunk of arthritis overnight like that, but the little tiny crystals, which could be bothering somebody. So, and I have very flat feet, and I take that myself because I get arthritis on my feet because it's just a structural problem I've had since I was born. So again, we talked about our cytokines and inflammation. So one of the things is calcium will show up where there's inflammation. And that's why we get, and that's let's go back to our diabetes and our nutrition and everything, and put a little bow on everything and the stress. When you're under chronic stress, you're using a lot of cortisol. Cortisol, a matter of fact, your adrenal gland, which we don't even talk about in medical school anymore, right? And it's funny because Lilly Pharmaceutical used to make a prescription, and my doctor gave it to me, a shot of adrenal tissue. So it's desiccated adrenal. I use it all the time. It's available. But anyway, so when you're under chronic stress, the adrenals use up all your vitamin C. Your vitamin C, because every organ uses more of one thing or another. Like, for instance, it wasn't a surprise to me that people with diabetes would be more likely to die from COVID. Why is that? In order to make insulin, you need zinc. You could literally be a type 1 or type 2 diabetic from lack of zinc. So if you have a lack of zinc, one of the things I showed our head of the resident program at Broward when COVID first came out were studies on the 5 different ways. First of all, zinc acts like a protective coating for those types of viruses, like even cold viruses that need to deep dive into that mucus tissue. So you're less likely to even get a cold or a flu or coronavirus with zinc. Then there's 5 different ways that zinc actually prevents the replication of these types of viruses. So, zinc, that's another reason why people lost their taste, because zinc facilitates the taste buds, the taste in the tongue is moderated by zinc. So if you have a zinc issue, a zinc deficiency as it is with your diabetes, it wouldn't surprise me that you'd get worse COVID because you don't have that zinc available that other people would have in order to fight off that virus. Same thing, I showed the physician vitamin D studies. I have about 25 that show anybody that's ever died from any condition in the hospital, any infectious condition in the hospital, is vitamin D deficient, whether it's fungal, viral, or bacterial. They're vitamin D deficient. They gave at a hospital, there was a study done in Canada where they gave the flu vaccine to one group of hospital employees, and they gave vitamin D to another group. Guess which group had less flu that year? It was the vitamin D group, had less flu. So every one of my patients got put on zinc and vitamin D at the beginning of COVID, and an immune builder that I have. And what are immune builders are things that will help raise like your T killer cells and things. And these things are like mushrooms, or there's a product I use, it's got desiccated thymus and spleen tissue. So, and they've shown in thymus, there's thymosin. Now, a lot of this work actually is done in Eastern European countries. They must use a lot of the animal tissues for their health things. I don't know what happened here, but maybe, were we done? Are you guys following the thing, the notes? I don't know. Technology isn't my forte here. Okay,